Welcome back to the Wild Wisdom Podcast. I'm your host, Alyssa Finning. Today, I have a very special guest. Her name is Marcia Miller. She is one of my dearest mentors. I studied with her at Yoga on High in Columbus, Ohio, and she is a certified yoga therapist, among many other special things, and has a wealth of knowledge being a yoga therapist for almost 30 years now, I think. I'm going to let her tell you more about her background, but we're going to dive in today to yoga as a therapy, urban Zen, integrative therapy, trauma-sensitive yoga, and all kinds of things that are close and dear to my heart, because for all of you that know me, you know that's what I'm really passionate about. And I got there being introduced to all of the transformative practices from Marcia and her team at Yoga on High. So, Marcia, thank you for coming on today.
Well, thank you for inviting me. I'm so happy to sit with you virtually and have a conversation about all these things that are near and dear to my heart as well.
Oh, great. Like I said, I like to start with sharing with the audience more about your background. Where you started, where you are now, and anything you mention as we discuss, we'll always put links in the show notes, like a link to Yoga on High. But tell us about you.
Well, I took my first yoga class in college back in the day before yoga was much of a thing. And after my second class, it took me a couple years to get back to my second class. And when I got to my second class, that was it. I was hooked for life and literally have been practicing every day since. And that was well over 40 years ago. So it's been, yoga itself has been a practice that stayed with me my whole life. And I probably started teaching way too early. And after a year or two of intensive practice, I went right to teacher training and have been teaching ever since. So my experience of yoga as therapy is that it is. Even from, and you know this too, I'm sure, from teaching beginners and people with any kind of ailments, any yoga is therapeutic when done in a safe and in a way that is supportive of the person in front of us. And I say just, the changes in mental and emotional states and regulation, and how the physiology of the body shifts when we give it a chance to regulate itself, are really powerful. And so really any thoughtful yoga practice is therapeutic on a basic and sometimes a very deep level. In the early days of my teaching, there wasn't such thing as yoga therapy training or organizations or even really many workshops we could go to. And so my therapeutic approach started one-on-one with people who had ailments and would say, gosh, I have this going on. Do you think yoga could help? And there wasn't much research. I didn't know, but I would usually say, well, come to class and let's see. So that's how my therapy started. And it really started by listening to my students and working together with them to see what did help, and just this intense curiosity together. And that is actually something that I think, and as you know, Alyssa, that's part of my training. I encourage everyone who's interested in the therapeutic practices to learn to develop a relationship with their clients. Students, oftentimes we're friends with them at some point after we've developed a relationship, and be curious together. Nowadays, because of the amazing trainings that are available all around the world, I would say for me, I have a better starting point. Like, oh, well, let me suggest this, try this. I have a lot of experience. I have a lot of training now. And so I have better starting places than I maybe did 30 years ago. But it's the same process, actually, of building relationship. And then the thing that's cool about that is when we practice yoga therapy this way, the student, the person who has the issue, is invited to really pay attention to what's going on for them. So they're in charge and they get to pay attention in a deep way where they say, yes, this helps. No, this doesn't help. Or yes, I think we're headed in the right direction. And so they're fully participating in waking up communication within their own body, which is very exciting.
Well, and that's what I really took from studying with you, Marcia. And still to this day, when I explain to people, or even, because now we offer 200-hour, the studio I own, when teaching those teachers, like I talk about, we're guides, we're facilitators, we're working in partnership, and the students or the clients, in my case, they, deep down they know, but they may not know everything, and that's why they might need a guide, but we're not the fixer.
Right.
We're giving them tools to help them thrive on their journey and come back to balance. And that is one of the core things I totally learned from you.
Yay, I'm so happy to hear that. Well, and we know from talking to people and from just knowing people who have illnesses or injuries in their bodies that someone with back pain is not like other people with back pain. There are some principles of well-being that go across the border, across the, spectrum, but excuse me, but your personality, your history, your relationships, your how you think of yourself out in the world and how you are in the world is all part of what's going to help you deal with your back pain. And people are so different. So there isn't just one thing I give for back pain. I'm with the person in front of me, and also, as you say, the person in front of you also actually has wisdom that we can help them affirm. And that's what I love to think of myself as. I came home from a program I did last night, and I told my husband, it's so great. Basically, I get to say yes to people. They say, here's what I think is going on, and I go, yes. And now let's figure out what to do with what you already know. And it's it's really beautiful, and it's such a process of affirmation to something that's deep within people already.
Mm-hmm. Yes, so reaffirming for them. And that reminds me, I just saw an email from one of our students, and one of the things that stood out, and I just saw it this morning, was thank you for being so caring. So like in you saying yes to people last night and reaffirming or empowering and supporting, like that true caring shines through.
Yeah, that's beautiful. It's not as common in our culture as we would like, and it's definitely not in so common in the medical model. And so we can look at diseases rather than people, which is how our medical model works, and we fix people. And yoga has so much more to offer than that. As you said right at the beginning, it's not about fixing. And so I think the yoga model of wholeness, that we're already whole in all the ways that matter, and we maybe have back pain. So how can we use our deepest wisdom to see, do we need to work less? Is this something about stress? Is there actually something technically damaged or injured in the body that we can help support? And then the yoga practices of meditation and relaxation and breathing practices, which are so calming to the whole nervous system, are great in any situation. That's not a yoga for cancer or a yoga for back pain. These practices are for all of us who are human beings.
Mhm. Yes, I agree. So, Marcia, can you expand and share a little bit more? Because talked about all yoga being therapeutic, but really, what is yoga therapy? Now in the sense in this modern age as it's starting to thrive, and I'm sure that's a loaded
Yeah,
question, but
I'm, yeah.
for our listeners, just to understand that, and of course there are so many different approaches. And I mean, within my studio alone, we have Iyengar and Vinyasa, and then I've learned many different styles when I
Yes.
studied with you, and then continuing ed, um, and so there's just so many different approaches. But just like whatever you want to share an overview, and then we can go deeper into that.
Well, it is a loaded question, and it's a topic that's of great interest in the entire yoga community now. And I would say, as I often say when I'm talking about yoga, people with a lot of experience don't completely agree on this.
Mhm.
And so some people are really, when they talk about yoga therapy, they want a strong medical model so that yoga therapists can be part of a medical team in a way, in a hospital or in a medical setting. So
Mhm.
they want yogis to understand in-depth anatomy and physiology, which I would agree with, and also then the medical practices that people are likely to receive if they have a particular diagnosis or disease. Um, I'm a little bit more on the side, as I said before, of forming relationships to students. And I have worked with people with many, many, many different kinds of diagnoses and injuries. And I find a certain level of knowledge about human anatomy and physiology is very, very helpful. And I'm also looking for the practices that will serve the person in front of me. And I'm not interested in dealing with a disease particularly, although I like dealing with people who have diseases, if that makes sense. So when I've worked with people with cancer, and I've also been involved in a major study at OSU studying the effects of yoga for people with cancer, we did come up with a basic curriculum, but it had enough different points of focus that people could focus on, well, I want the active poses more. I feel like that's what I need now in this phase of my treatment. And some people would focus more on the more restorative poses because that's what they need. And so there were enough, it was a big enough buffet of choices that people could practice what they could at home and call on that. So when we talk about yoga therapy, we are working to help people um, heal whatever is in their body mind process that wants healing. But I think of that more as integration and the word you just used, the caring of ourselves for each other and ourselves for ourselves. And
Mhm.
so the other beautiful piece of yoga therapy is actually that and I know you're good at this, Alyssa, we have to practice ourselves in order to be full, open, spacious supporters for others who are suffering. And
Yeah.
so
And I
one
think
of the
that's
things that
so
Rodney
important.
Yee, who was one of the founders of Urban Zen, said, if you're going to bring health into a hospital system, you have to be vibrating that healthy level yourself, because we know from, and we even know this from science now, that we affect people within in at least a 10-foot radius. The heart math research shows that. And so if I'm radiant with health myself, you just being within 10 feet of me are going to get some of that vibration, and something in your system is going to understand more about health than if I come to you exhausted and injured myself.
Mhm.
And so we learn from each other on multiple levels.
Yeah, so
And the
true.
yogis know that. Like health in some ways and vitality is catching. We get inspired. We get to realize, oh my gosh, this is what vitality is. I want that. That's one of the reasons that I studied with my first teacher. I walked into a room with him and I realized whatever he's got, I want that. And some of it was a deep calmness of mind, and some of it was a sense of vitality. And I'd never met anybody with that strong of a life force before. And that was interesting to me. And that's one of the reasons I'm still doing yoga, because I saw the potential for what it could do for us and what it could be.
Well, since we mentioned urban Zen, do you
Yeah.
want to share more about that? And maybe that'll lead us into a trauma sensitive conversation. But I love the practice of urban Zen. I haven't done the certification, but maybe just sharing that. I think it's
Sure.
so um, interesting, profound, and needed.
It is. It's one of my passions to keep bringing urban Zen out into the world. And so what it is it's called Urban Zen Integrative Therapy, use it for short, UZIT, and it's a combination of techniques and tools and practices that we have found layered together to be fantastically potent together. So we know yoga therapy, especially focused on asana, works well. So we have an asana an asana arm that's very simple and can be done anywhere from a hospital bed to a hospice room to a school to a corporation. Very simple but profound practices of movement and restoration, such as different shapes that we can put the body in. We use breath work and guided meditation. We use essential oils. We use a few really potent basic essential oils that can help with a lot of different symptoms, which I'll mention in a moment. We use Reiki, which is a hands-on or gently off energy practice / therapy. We use another really potent practice that we call bearing witness in urban Zen, which is practices that we have done to take care of ourselves so that when we are present with someone who's suffering, we can be fully present and not freak out and not make difficult situations worse.
Mm.
And that is actually a huge part of the practice that all of us who are therapists and who have gone through this training find that this is one of the best things that we've ever done for ourselves in terms of being present both to ourselves and to others.
Mm-hmm.
And
Yeah,
it's
I totally agree. I'm glad that's a part of that
yeah.
program.
So we also have a huge self-care module because we are working in very challenging and difficult situations. We know, as I said earlier, that we have to take care of ourselves and keep restoring and renewing ourselves so we don't burn out. We have a model where we work with symptoms rather than diseases for the reasons I just mentioned earlier, because each person is different. And so you might have cancer, but what's bothering you today is nausea.
Mhm.
Or you might have, just gone through surgery and you may be okay in the nausea department, but you have severe pain. So we work with symptoms including pain, anxiety, nausea, insomnia, constipation, and other digestive issues. And of course, if you have one or more of those, you're probably exhausted. And so we work with exhaustion as well.
Mm, okay.
It's such a beautiful practice. We found that having this big toolkit of practices that we bring to the patients or clients, we do work a lot in hospitals, but we also have found this work is super effective. We have few people working with drug and alcohol rehabilitation and addiction. We work in schools, we work in corporations, we work with people who have experienced trauma and or secondary trauma from being caregivers to those people, which we can talk about in a minute.
Mm-hmm.
And so we find it, and we work in hospice, both with staff as well as patients and families. And we also understand in urban Zen that every person who is involved in any way in touching a client needs this care. So in a hospital setting, for example, we work with staff, we work with patients, and we work with family members, because everyone who has contact with the patient, if the staff person is exhausted, they won't be as helpful. And if the family member is exhausted, sometimes the family member is a great support, and sometimes the family members can be problematic. And so we work with them. And it's very satisfying. I also have been a Reiki master for over 20 years now, and I've seen the power of yoga and Reiki combined for years. We've been doing that. And when we added essential oils and um, the way of really being present to someone that we've called bearing witness, the benefits are just incredible. And we love doing it. We keep calling each other. Those of us who've been doing this work for years, I'll get a phone call from someone who will tell me an amazing story, and we'll just both look at each other and go, wow, this stuff really works, doesn't it? Even though we've been watching it work for many years. It can be quite miraculous at times. And I think what people also are enjoying is that there's another person, wherever we are, there's another person who's saying, what you're experiencing matters. And we have some tools to support you to be doing what you want to do, whether it's be healthy or whether it's help another person. It's really great. We do these urban Zen trainings every year or two. We have one coming up in July this year, and it's quite exciting now. We've been doing this work for over 10 years, and it is a therapeutic. It's interesting. It is a therapeutic work way of being in a hospital setting, and I've worked a lot in hospitals. So have some of my other graduates and trainers, and we're welcomed there as support for the team, even though we're not working on the same medical model that they are. We are support for everything. It's complementary to everything that's already happening there. And so it's really great to go into a room where someone is in excruciating pain. They've been given all the pain medications they're allowed to have at that time, but maybe their level of anxiety is also so high that it overrides the pain medication. And so we help them get calm, we help them fall asleep. We That's a huge support for the nurse too, because then the nurse isn't running from room to room, dealing with people who she doesn't have any more tools for.
And especially the way it I know you do it in many different aspects or different places, and graduates do it there. But in the hospital setting, just having worked in the hospitals as a yoga therapist, which I thought was my dream job, and then realized that's not what I want to do. Um, but so I wanted to do the approach. I didn't want to fit into the medical model because I had a whole different way of thinking. But I find that, the way Urban Zen is helpful and complementary into the hospital setting or hospice setting or, wherever. It's a way to give relief and be helpful without having to necessarily integrate too. So a very different way to bring that therapeutic yoga into the setting. So I really like that. And we'll link to your training.
Okay, thank you.
Yeah, we'll definitely do that in the show notes.
Great.
So anything else you want to talk about Urban Zen, or maybe we'll shift into how yoga as a therapy is helpful for trauma? You kind of talked a little bit about it.
Sure. And I think there's some overlap with Urban Zen as well. And Urban Zen isn't the only modality that we can use with people who've experienced trauma. So this is getting to be very interesting in the yoga world, because what we're seeing is yoga teachers all over the country, because of the depth of their caring, because of huge hearts of people wanting to go into settings where they know that people haven't had access to yoga before, or they themselves have experienced some kind of trauma. Maybe you've been in prison and you want to help other prisoners, or maybe you've been addicted to something and you want to help other people who've experienced drug addiction, or maybe you've experienced sexual trauma, and one of your ways of supporting yourself is to give back. You have a sense of empathy for people who've experienced sexual trauma, and so you want to help. It's so natural how our hearts work in this way. And what we found over the years is that level of caring really isn't enough. And that there are certain things that we need to learn and know about in settings where people have experienced trauma, so that we don't make anything worse for people. And so we have worked hard to develop a program that does that. And some of the elements, for example, in trauma sensitive yoga, are to have an understanding of our own capacity. And so what we've seen in our trainings over the years is that people are surprised that when they have this heart for wanting to do the work, sometimes they actually need to have more healing themselves. And that was one of the comments in last year's group that we had that said, wow, I didn't realize how much more I needed to do for myself. And now I do feel like I'm ready to go into the community. Mm-hmm. You want to be able to have the capacity to be present for others and not have them end up taking care of you.
And that is such an important aspect. Sometimes I touch upon it in this podcast because it always seems to come up. There are a lot of people who want to help, more often than not, because we've experienced our own traumas, whether they're little ones that add up over time or big ones. And if we're not dealing, because I've had my own stuff, if we're
Sure.
not dealing with our things, and it's not like it's suddenly you snap your fingers and it's fixed, it's a journey in itself. But if you're not
Correct.
dealing with that on a regular basis, and I've seen this happen, you're trying to fix people to fix yourself.
Yes.
And just being conscious of that.
Yes. And we talk about too that we also don't we have the heart for the work, and there might be some groups that you will be very skillful with, and some others that maybe aren't right for you. And to know yourself well enough to know your capacity. And then you can go out in the world and really be of service in the way that, as we've seen, so many people want to be of service. They have these big hearts filled with compassion, and a little extra skill along the way is helpful. Some of the most popular things about yoga these days, the really fast-paced, sweaty classes where people are working very vigorously in a fitness-based environment, may not be the kinds of classes that are most effective in many places where people have experienced trauma. And so people want to have a wide range of skill sets. We start most of our trauma sensitive classes at Yoga on High in chairs, because what we find is we work with veterans, we work with so many different populations. We've worked with women who've been sex trafficked, lots of sexual trauma, people who have experienced what we might call physical and emotional trauma also have other injuries. So a lot of the veterans that I've worked with female veterans for a number of years, they have back pain or ankle or knee pain from actually being veterans. And also there's often chronic pain associated with many people who experience PTSD, for example. So the yoga teacher has to have a pretty big toolkit to meet somebody who may have a lot of anxiety. Also, they might have physical issues, and it's all showing up at the same time.
And that can show up in group classes and not even trauma sensitive classes.
And completely does. Yeah.
Yeah. And the importance of a teacher who's interested in doing that, because, a lot of people do have big hearts. And even here in Indianapolis, they're going to the addiction centers and they're going here and here. But actually empowering themselves with the trauma sensitive training and understanding that, so they're doing more good than possible harm.
Yes.
Do you still offer that 100-hour trauma sensitive training? I know that you did at some point.
We do. We have what our current schedule is that once a year we offer a 3-day weekend, which is pretty comprehensive, I would say. And then we realized that we actually had a lot of students who said, well, this was great. This gives me a really good starting place, and we want more. So we built a 100-hour trauma sensitive training program, which is going on this year. So we'll have the weekend in 2019, and then we'll do the full 100-hour program in 2020 again. And we find this is really the best way for people to dive deep into their own work and their build their skill set for whatever populations they want to work with. And it helps them figure that out. Sometimes they know when they come, and sometimes they find out. And we teach them chair classes. We teach them different guided meditation practices. We give them full curriculum for an 8 to 12-week course, so that they have basic programs to work from, and then they can fine tune for their own populations. It's really fun. I am a part of that program, and part of the work is how you bring this out into the world, and the other part of the work is really what you need to keep doing this work. And Michelle and I, who co-teach this program and run Yoga on High together, are constantly dropping into our own self-care practices and realizing that you can't do everything. You can't only be with people in pain without having a lot of joy and rest in your own life. And then we can bring that along with our empathy. And then when I'm in a room with people who, many of whom might have PTSD and are super anxious, I can be present and empathize with that, but I'm not immediately going to go there myself.
Mm-hmm.
I can be a strong enough anchor in the room for calmness. And that's a phrase that I've used myself, that my goal as a yoga teacher is to be the calmest person in the room and to let people anchor to that calmness, which we all have at the core of ourselves, but oftentimes anxiety is overlaid on that. So um, it I won't be that helpful to a group if I have 10 people with PTSD. They're all super anxious, and then I'm in the room anxious with them.
Yeah, I like how you put that about, being an anchor of calmness and being the calmest person in the world. It's beautiful and very needed for sure. And a great way to look at that when you're working with trauma sensitive populations or just, an anxious group or
Yeah.
any group.
Well, and our world is full of anxiety right now.
Mhm.
Really, when I first started teaching yoga, people weren't anxious the way they are now. And now, even help, I don't know what a percentage is, but I know the level of anxiety in individuals and in our culture as a whole has gone up dramatically in the last 20 years. And we deal with that in every class. And I'm sure that's every yoga teacher. So, can we try an experiment?
Sure.
So, we've been talking for a little while. Let's take a break where we all refresh ourselves. And I have here an essential oil called Citrus Fresh, which is a combination of citrus oils that are very pleasant and both energizing and relaxing.
Mm-hmm.
And although you may not have that oil and your listeners may not have that oil, perhaps you could think of your favorite fragrance that just when you smell that plant or that food or that person even, you just go, oh, that's just what I want right now. And even the imagination itself can be really potent. We'll just take a few moments of a break to refresh ourselves right here, even in the midst of an interesting conversation. And so, Alyssa, what are you noticing when I'm inviting you to think of your favorite smell?
Yeah, I closed my eyes and I thought of more floral. Lavender was
Mm-hmm.
the first thing, but kind of more floral like rose and
Mm-hmm.
just that fresh smell, that calming scent. But just being able to in the moment tune in and find that refreshment or rejuvenation just by taking a minute to stop.
Yeah, great. And I'm guessing, I can't see you from where I am, but I'm guessing you have a little smile on your face too.
Yeah. Yes, I do actually.
So this is the kind of practice we do in Urban Zen and also in some of our trauma sensitive classes, to just interrupt whatever's going on in a way to come back to something that's soothing and refreshing and perhaps energizing, whatever is needed in the moment.
Mm-hmm.
It doesn't have to be 2 hours of yoga every morning or in the evening. It can be a few moments like this, um, interspersed throughout the day. And that actually is possibly more useful. We don't have full on studies for this, but a lot of the meditation teachers that I work with and learn from are saying regular interspersing of even 10 to 15 seconds of practice a day, 10 times, let's say, is very potent in keeping whatever your regular practice, let's say you have a regular 30-minute practice in the morning or even 15 minutes. If you intersperse 10 or 15 seconds throughout the day, it will be very powerful and you will build the neuronal circuits to keep your brain refreshed and interconnected with all the parts.
Yeah, and that's powerful because most people don't have all the time in the world. That's usually the biggest barrier is finding time for themselves.
Correct. I remember I started we took Urban Zen to South Africa a couple of years ago, another colleague, two colleagues, and myself. And my basic goal for a starting place is to invite people to find 5 minutes where they can take care of themselves. And normally, most people are willing to do that. I would like them to build it to 15 to 20 minutes a day. I think that's reasonable. But start with something that's very doable. And some of the people there in South Africa said, nope, I don't have 5 minutes to myself. And it was in it. And when I learned more of their lifestyles, I understood why. Many of them worked hard and then they would go home to small one-room houses where there might be 5 or 6 people living there. And so they really wouldn't have space for themselves in the way that we think of here in the West. And but I've also had people, in corporate jobs who said, 5 minutes. Oh my gosh, no, I could never do that. I have to be available to my clients 24/7.
Mm-hmm.
And I sometimes I'll say, well, do you charge your cell phone? Like, do you put gas in your car? Like, the things that help us do our work, we know to recharge them. And we're not going to be much good to our clients if we're not recharged ourselves. So this is part of the movement that yoga can bring to the world, which is take care of yourself. It's not selfish. It's how you engage in a useful level in whatever you care about. Can I say one more thing that I'm excited that I'm involved in? Because this is really, you can tell this is a passion in my life. I have been presenting at trauma-informed care conferences this past couple of years. And what happens is somebody hears my talk and then they say, well, can you come to my work and help us all learn some skills for taking care of ourselves?
Mm-hmm.
This is very exciting, Alyssa, because what people used to say is, can you give us a workshop or can somebody give us a workshop on the dangers of secondary trauma, the kind of trauma that you experience when you're with people who are traumatized all day long, which is so many people in our culture. And especially with the opioid epidemic, people are with not only people who are killing themselves through overdoses, but also then there are people left to take care of the children. And so these are some of the people I've been working with who in the past they would get research and studies about how dangerous what they were doing was for them, but not the skills. And now they're going, okay, we need workshops on just give us the skills of taking care of ourselves. So I've been going around the state of Ohio this year, working with people who have mainly been affected by the opioid epidemic and mainly working with children. And I get to teach them 3 hours of self-care strategies. And it is so fun to walk out of the room with them at the end of 3 hours and see people who have melted into the state of relaxation and who've been with someone who say, what you do is hard, and I want to help you keep doing it. And so I think for a lot of yoga teachers, that's becoming our mission to help support people who are doing really, really hard jobs in the world. If you are running an orphanage of kids, many of whom their parents have died to violence in our cities and also death through addiction, overdose, that's a hard job. That's a really hard job. And people are called to that work. These are jobs that are callings. They're not jobs that you just go to because you need minimum wage. And I want those people who are called to this really intense, deep, meaningful, necessary work to be able to keep doing it and not burn out.
Yeah, I love that you're doing that. And I'm glad you added that in because it was right before I was going to ask you if you wanted to share anything else. So it's perfect.
Oh, great. Yeah.
And, I would love actually maybe to even have you on in the future to talk about, because that's a huge thing, the whole opioid crisis and how it's affecting everyone in so many ways, but even expand upon the things that you're sharing. So we'll put that in the queue for the future because I think more and more people need to realize that, but I'm glad you're speaking on self-care and sharing that. That's actually where my work has went to in the corporate settings. I used to teach more on mindfulness but then I was like, I want to teach people how to take care of themselves and, like the basics, like sleep and move and those kind of things. And I started switching that because it's not the easiest sell. And then, this spring actually and summer, I have a couple engagements for women's groups. And I'm talking about, because you always have to meet people where they are, but rather than calling it self-care, talking about revealing their inner radiance. But the whole premise is, how do you take care of yourself? And just kind of giving that. So I think that's important. And I'm so glad that in speaking at the trauma-informed places, that evolved into something more for you, because I think that's exciting.
Yes, it's great. And how to keep it as a culture, don't we want people doing these jobs to be able to keep doing them? Like if I'm on my deathbed and I have caregivers around me, in addition to my family, hopefully, I want the caregivers to have a sense of rest and ease. I don't want it to be stressful for me or for them.
Yeah, and they're not taught it any other way, unfortunately. I mean, there are probably programs now that are incorporating that, but they're not taught how, when you have no idea, you can have the biggest heart in the world, but you still burn out. Right. And so I think that's important work, and I'm glad you're doing that. And thanks for sharing.
Yes.
So I appreciate you being on the podcast today, Marcia. I love all the things that you do in this world and everything that you share. And when you share your knowledge, share your skills, and all the things that you offer, it's quite amazing.
Thanks for inviting me. I love that you're getting it out into the world as well.
This is my, mission of education, because I want more people to know that there's a different way to heal. There's a different way to come back to balance. And so many people are seeking those ways. And so here we can help them. And so, and I really appreciate you being on today. And we might explore more in the future, because I know you have tons of things that you can talk about.
It's true.
All right. Thank you, everyone, for listening into this episode. And we'll be back next week with another episode of the Wild Wisdom Podcast. I'm your host, Alyssa Finning. Wild blessings.